Today we will learn about the applied anatomy of the knee joint. Okay. Okay. Applied anatomy of the knee joint. So far we have discussed about the knee joint and its various components, how the knee joint is formed, how it is established, how it is stabilized, how it is stabilized in movement, and what are the minimum biomechanics, that is locking and unlocking of the knee joint. So we'll see the applied anatomy of the knee joint. The first thing is knee jerk. As I have demonstrated in our anatomy lab, the knee jerk is also called as patellar tap, tapping the patellar tendon. The knee jerk reflex is demonstrated by hitting the midpoint of the tendon with a tendon hammer, often with the knee hanging flexed. This is very important, or knees crossed. So the leg must be relaxed. This should elicit contraction of the quadriceps muscle, because when we tap on the patella tendon, the patella itself is in the quadriceps muscle, which extends the knee and tests the integrity of L3 and L4 nerves. We have already seen this in an anatomy lab, and this is the tapping of the patella tendon, and the muscle receptors in the quadriceps received it and transferred this to the spinal column. Okay, so hammer tap, sensory neuron synapse with excites motor neuron in spinal cord. Sensory neuron also excites spinal interneuron. Interneuron synapse inhibits motor neuron to flex muscles. Motor neuron conducts action potential to synapse on extensor muscle fibers, causing contraction. Flexor muscles relaxes because the activity of its motor neuron has been inhibited. Leg extends. So the immediate extension of the leg is called knee jerk. Okay, so knee jerk is important because it tests L3 and L4, the integrity of L3 and L4. Sorry. Coming to the next applied anatomy, next applied point is the back assist. Back assist is rupture of the synovium of the knee joint as a consequence of the osteoarthritis or synovial herniation, results in a cystic swelling in the popliteal fossa. So when the synovium of the knee joint ruptures as a consequence of anything, synovial herniation, osteoarthritis, or whatever it may be, so the rupture of the synovial joint cavity into the popliteal fossa is called as back cyst, because it looks like a cyst when we look from the back of the knee. The lump is fluctuant but not tender. This is very important. No tenderness. But if the cyst leaks, fluid may track down cough, which becomes swollen and tender. So when the fluid in the back of cyst occupies the compartment, it will become swollen and tender because it will become compartment syndrome. Remember the compartment syndrome as you have discussed in length many times, mimicking a calf vein thrombosis. Okay, so this is Becker cyst. Okay, the cystic swelling at the back of the knee. Here it is normal, here it is not abnormal. Okay, you can appreciate this. Okay, this is the back cyst. Okay, this is the MRI back cyst sagittal T2. This is arrow. So this is back cyst. Okay, between margin of medial gastrocnemius muscle and posterior margin of medial condyle with pronounced hyperintensity. Lesion partly lobulated and partly septated in addition. Okay, the whole of this is Becker cyst. Lobulated Becker cyst. Right, this is the appearance of Becker cyst in MRI. Right, coming to the, this is Becker cyst. Okay, a large Becker cyst. Again, this is large Becker cyst. Same thing in T1 and T2. So large Becker cyst, T1 and T2. Overt cystic lesion intense, iso-intense to fluid at medial margin of gastrocnemius muscle, markedly hypotension. Okay, so this is the cystic lesion at the popliteal fossa because of the rupture of synovial membrane of the knee joint. Is called as Becker cyst. Okay. Am I screening my sharing my screen? So this is Becker cyst, right? All of this is coming to the next. So the stability of the joint depends entirely on its ligaments and neighboring muscles, but because it's a mobile weight bearing joint, we have already discussed this. Injuries are common, especially in sports involving running and physical contact, such as soccer or rugby. So especially in the football or during cycling or rugby. Okay, cycling and motorbike accident, everything. Most injuries occur when a side force of the knee to the knee is applied while the leg is weight bearing. That is when the foot is fixed to the ground. So when the foot is fixed on the ground and a blow comes from the side, okay, that is when it is most devastating to the person. A blow to the lateral side may result in tearing of the medial tibial quadrilateral ligament and through the ligaments attached to the medial meniscus, tearing of the medial meniscus. The knee is particularly prone to this injury when flexed, as it is when that the collateral ligaments are slack and making a little contribution to the stability of the knee joint. So rupture of the cruciate ligament is the result of severe anterior posterior force being applied to the knee. So this is flexion, this is extension. So when the when the leg is flexed, okay, lateral collateral ligament or fibular collateral ligament is lax. When it is extended, lateral collateral ligament is taut. So when it is flexed, when the leg is flexed, the knee is more prone to injuries because the knee is least stabilized. Okay, so when the knee is extended, knee is more stabilized. Keeping in view of this injuries, when injuries occurs, when the what is you have to think of the position of the leg, okay, so that you can assess the grievousness of the injury, what may happen before doing any investigation, right? So the components of the knee joint are cruciate ligaments, menisci, and collateral ligaments, and also capsule and synovial membrane. We will discuss what will happen to these structures, okay, clinically. So cruciate ligaments, okay, they may tear because of the force. We have already discussed when we are talking about the anterior cruciate ligament. Anterior cruciate ligament is more prone to injury than the posterior ligament, ACL rather than PCL, especially in coming to the injury. Okay, and again it is non collisional. Most of the time the tears occurs in anterior cruciate ligament without a collision, because whenever we are running fast and we suddenly wanted to shift our direction, that is when the anterior cruciate ligament mostly occurs. The sudden pivotal shift causes without any collision, okay, causes anterior cruciate ligament rupture of the anterior cruciate ligament. This is a normal ACL, MRI of the normal ACL. This is the normal ACL. Again, this is also the normal ACL. Coming to the, this is partial tear. సో ఎట్లా ఉండాల్సింది ఎట్లా అయిపోయింది. ఎందుకు పార్షియల్ టైర్ వలన ఏమవుతుంది? బికాస్ స్ప్రెడ్డింగ్ ఆఫ్ ద ఫైబర్స్ అక్కర్స్. ఓకే, దిస్ ఈస్ వెరీ ఇంపార్టెంట్. Spreading of the fibers, and if we don't treat this immediately, there will be thickening also. Delayed, okay, delayed treatment causes thickening. So See, anterior cruciate ligament is fibers are spread. Okay, this is also partial tear, spreading of fibers occurred. This is also partial grade, spreading, and this is complete rupture. There is no continuity. Okay, here it is discontinued. There is no continuity of the fiber. So tears, tears, tears are, they may be sprained or partial thickness tear. I'm sorry. So tears, cruciate ligament tears, whether that is ACL or PCL. Okay, 3, sprain, partial thickness, and full thickness. This is also called as total or subtotal tear. So whenever the anterior cruciate ligament becomes tear, there will be severe pain, swelling, and especially click or pop. Okay, this is the most important thing. A click sound occurs. Okay, whenever there is locking and unlocking of the knee joint, that means whenever we move the leg, okay, flexing and extending, there will be a click sound or pop sound, cluck cluck cluck. The patient will feel it, and that is within the intra compartment of the knee joint. Okay, so in order to assess that, we have to test the knee joint. Okay, test the lower limb, that is called as to test the stability of the anterior part of the knee joint is called as anterior draw test. There are many tests in lower limbs. Okay, but minimum you have to know these things. Anterior draw test, that means a positive anterior draw test is when the proximal head of the patient tibia can be pulled anteriorly on the femur and patient lies supine on the couch. The knee is flexed at 90 degrees and the heel sole of the foot are placed on the couch. The examiner sits gently on the patient foot which has been placed in a neutral position. The index fingers, whether the hamstrings are relaxed or not. The tibia moves forward. This is the most important step. Tibia moves forward. The anterior cruciate ligament is torn. On the peripheral structures such as the medial meniscus or meniscotibial ligaments must also be damaged to elicit this sign. So this is anterior draw test. You have to passively flex the hip joint, flexively flex the knee joint, and put your hands behind the tibia and just draw the tibia towards your side. Okay, towards your side. Okay, stabilize the foot, check hamstrings for relaxation. Patellar tendon, apply anterior force. Okay, this is called an anterior draw test. So if the ACL is torn, the tibia will move anteriorly. Okay, tibia will move anteriorly. If the ACL is torn, if the ACL is intact, tibia will not move that much, right? Okay, see here, grades. Okay, this is the anterior draw test. Okay, tibia is moving forward when the ACL is torn. Okay, coming to the PCL. I'm not sharing my screen. Excuse me. Okay. So this is PCL, high intense band, slightly curved proximal portion between. This is the PCL. Okay, this one. Okay, this is the total rupture of PCL. Total rupture. Okay, there is no continuity and there is spreading of the fibers. Okay, you see, this is the total rupture mid substance PCL tear. Okay, in order to assess the PCL tear, we'll do the posterior draw test, which is the same as anterior draw test, but you have to uh, forward the tibia away from you. Okay, that means you have to push the tibia posteriorly so that the whether the PCL is intact or not, you will know that. So occurs when the proximal head of the patient tibia can be pushed posteriorly on the femur. The patient is placed in supine position and so knee is flexed. Examiner sits gently on the patient foot. That means stabilizing the foot, tibia and push the tibia backward. If the tibial plateau moves, the posterior cruciate ligament is torn. So if the tibia moves like this, then there is PCL torn occurred, right? That is ACL and PCL tears. Okay, they may be sprained, they may be partial, they may be full thickness tears, and in order to know them, you have to do anterior draw test and posterior draw test, right? This is the posterior draw test. Okay, PCL. Coming to the menisci, menisci also become, we have covered cruciate ligaments. Now we will cover the menisci. Menisci will become rupture tears. Okay, there are if the tear happens along with the long axis of the menisci, along with the long axis of the menisci, it is called as horizontal tear. Whereas if the tear occurs perpendicular to the long axis, it is called as radial tear or vertical tear. Okay, remember that. So horizontal tear is happening along with the long axis of menisci, whereas perpendicular to long axis of menisci. Okay, and if the tear occurs in the menisci like this, if this is the tear, okay, this is called as bucket handle tear. Okay, this is like that. Okay, this tear occurs along with the this, and this is called as parrot beak. This is complex tear. This is called as parrot beak tear. So basically, there are three types of tears: vertical tears, horizontal tears, and bucket handle tears. Here again in this meniscal injuries also you will hear click. Okay, click or pop sound. Click or pop sound. So there will be swelling. There will be pain. Okay, this is meniscal injuries. And there will be degeneration in the knee joint. Okay, with the advancing age, the body tends to degenerate. Degenerate means generation means produce, production. D means failing or reversal of production. That means it is literally failing in production. That means degenerative arthritis. Okay, there are many causes for this degenerative arthritis. Okay, most common site in the body is most common type of arthritis is osteoarthritis. Okay, it occurs in knee joint along with small joints of hands and toes. Okay, knee joint is the most predicted osteoarthritic joint, and in this, because of the degeneration, there will be cartilage degeneration will be there, and there will be osteophytes. That means bone growths, okay, into the joint. That is why old people have sounds. Okay, when we examine the knee joint, when we palpate it, we'll hurt, we'll feel crepitus. Okay, when we put our palm of hand on the knee joint and passively flex and extend the patient's leg. Okay, we will feel the crepitus. Okay, because of the degenerative changes. Okay, so there will be bone spurs, also called as osteophytes. Okay, and the process is called osteophytosis. Okay, cartilage loss and exposed bone. Cartilage will be lost. Degenerative meniscus, it's called sclerosis. Okay, because of this there will be decreased joint space, right? So this will be the x-ray. There is no joint space because there is no articular cartilage or there is no cartilage. So walking becomes painful, and especially ascending stairs and descending stairs also becomes painful. Okay, the whole lot of syndromes occurs along with this osteoarthritis. And if the patient has prior history of injury, the process will be fastened. Okay, if there are prior history of injury, osteoarthritis will happen more early in the patient. Okay, so that's the clinical anatomy of the knee joint. Now if you have questions, Please ask.